Hello, can everybody hear me? Good morning.
Yes, we can.
Fantastic. I'm ever so delighted to join with my beautiful colleagues and handsome colleague, the organizers of the Nigerian Diabetic Summit in the very first inaugural session. And I must congratulate the organizers for this. I mean, there is no better time to talk about this than now. And I'm really pleased that we are raising awareness at the highest level. I'm standing on the existing protocol to really appreciate every person who has been before us, but I cannot gloss over the protocol except I mention a few names. So please oblige me. I want to particularly acknowledge Professor Akin Oshibogu, who may not be around, but they played a major role yesterday. He's the president of the Nigerian Postgraduate College. I want to thank him and appreciate him. I want to appreciate our father in diabetes care and teaching, Dr. Sonny Kuku of the Eko Hospital. I want to also appreciate my big sister, Professor Felicia Numa, who was so passionate yesterday. I mean, the screen almost exploded with her passion, and I was very happy to listen to her. Hello, Ma, if you're listening to me, I want to appreciate you kindly. And I also want to appreciate Dr. Alkali Mohammed, the president of the Nigerian Diabetic Association. My name is Ifoma Monye, and I'm a chief consultant family physician and the president, and I serve as the president of the Society of Lifestyle Medicine of Nigeria. I have come here with my colleagues, very valued colleagues in the education committee of this brand new society. Many of you would have been hearing a lot since yesterday about lifestyle interventions, lifestyle measures, lifestyle prevention. And the word prevention, kept coming through the airwaves. Now, we will understand that lifestyle interventions is very critical in the cardiometabolic space. And why wouldn't we talk about prevention? Dr. Kuku yesterday let us know that at this point, an average diabetic patient in Nigeria will spend about 60,000 naira a month. And when you think about it on diabetic care, what is the minimum pay? Maybe 30,000. But with inflation, I'm sure that 60,000 is probably nearer 100,000 naira now. But so who can truly afford this? Not even the elites can be happy and joyfully spend 200,000 naira every month to treat or manage diabetes. But here is the good news. I want everyone to please indulge us in the next hour or so, where we will share with you the latest findings and scientific evidence that shows that we can actually prevent, treat, or in fact, in many cases, reverse type 2 diabetes using lifestyle interventions. And we like to talk about the lifestyle interventions or behavior change in our patients in 6 critical pillars. And they're the ones we're going to be discussing this morning. So we're going to talk about diet and nutrition. We're going to talk about rest and sleep. We'll talk about exercise. We'll talk about avoiding toxic substances. We'll talk about managing stress, and we'll talk about positive social connections. And these are key to managing diabetes. The title of this summit is Improving Management and Access to Diabetic Care. And I would like to say that employing all these 6 pillars in ourselves and in our patients will truly provide improved management and indeed improved access where the patient is indeed their own doctor. It was so beautiful to hear Dr. Kuku talk about yesterday how the patient is their doctor, their own nurse, their own clinician, their own lab technician, and all of that. And that is the message we bring. So let me start by asking this question. How many of our patients can actually relate the type and amount of food they eat to their health? The amount of physical activity or the amount they sit down every day to their health, or the amount of sleep they have, or in fact stress and or tobacco, or in fact whether or not it's important for them to form and maintain positive and loving relationships. I'm sure a lot of our patients don't even know, and a lot of clinicians and caregivers. So stick with us, and we're going to talk about this a little bit more. So I'm going to start by asking my panelists. This morning, I think I will start with Dr. Dozier. Hello, Dr. Dozier, how are you?
Fine. Good morning, ma'am.
Good morning. You see, Hippocrates, the father of medicine and an accomplished Greek physician, said many things in his lifetime. One very famous one often ascribed to him is this: let food be thy medicine and medicine be thy food. Indeed, this statement made 400 BC has been proved over and over again in several studies. Even though many of our patients are convinced about the crucial importance of food in causing or treating their condition, many healthcare providers have rudimentary knowledge. And let me just stop here to say, in our medical school, how many of us had 1 hour, 2 hours, 2 weeks, 1 week of nutrition teaching? I didn't remember having more than maybe 30 minutes or maybe more than just a mention of it. Diet and nutrition is arguably the chief pillar in diabetes management. The Diabetes Prevention Program landmark study showed compelling evidence proving that a whole food, plant-based, fiber-rich nutritional lifestyle with minimal saturated fat is in fact more effective in the management of pre-diabetes when compared to metformin. And this was a large RCT involving different ethnicities across 24/7 centers in the US. Dr. Dozier, how has this changed your practice in the management of type 2 diabetes? Please share with us.
Thank you very much for the very long question. Yes, so that study is a study that speaks to me. And I will encourage everybody here to go and look up diabetes prevention program. The study was so landmark that following that, it was supposed to be for a longer duration of time, but the outcomes were so dramatic, which I'll share here, that the study, for ethical reasons, they had to discontinue that study at 2 years, 8 months because of the outcomes. And of course, like she has said, it has changed my practice and opened up my mind, like a wow kind of effect that it has had. It was a large one, over 3,000 patients. They had 3 groups, the placebo, some people were giving advice, the placebo group. Then there was the intervention group that had to receive metformin, 850 milligrams twice a day with lifestyle advice. And then the lifestyle intervention group that received specific lifestyle intervention. So they had weekly sessions for 6 months, daily sessions for 6 months, then weekly sessions for another 6 months. And they had to listen to this dietary advice. They were supposed to reduce the fat they were taking, increase their fiber, and put in at least 150 minutes of exercise. So that was what the lifestyle intervention group did. And so they followed them up, because before then, if we would remember, pre-diabetes, once you're pre-diabetic, they will place you on metformin, which is glucophage. And so they were trying to find out if there was a need to continue this practice or if we should switch to lifestyle intervention. And by the 2.5-year mark, those that were on the lifestyle intervention group had reduced their blood sugar. The fasting blood sugar postprandial levels had dropped more than 2 times those that were on the metformin group, more than 2 times. I mean, it was so dramatic because even those that initiated that study did not expect those kinds of results. And the incidence of diabetes was 11% in the placebo group, I think 7.8% in the metformin group, and only 4.8% in those that underwent the lifestyle intervention group. So at this point, they saw there was no need. It would have been unethical to leave anybody on the placebo or on the metformin, and they had to discontinue that study. And it was so landmark that for the first time, because before now people had been trying to get lifestyle intervention, like the previous panel, they talked about how the advice, doctors, you treat and then you do lifestyle counseling, but nobody pays for the lifestyle counseling. And for those that know, we know that the counseling is even most times more important than the treatment, because knowledge is power. If you have knowledge, you have power. You know what to do, what not to do. And that was one of the studies that they have now incorporated into their insurance packages in the US. I attended the in the conference, American College of Lifestyle Medicine, their conference in the US, Texas, that was last year. And this was one, they talked about the results that they are now experiencing and how this study, they've incorporated into their insurance scheme and the outcomes. So more and more people are doing studies on those, the kind of interventions that you can actually get and the kind of results you can get when you don't necessarily, give them drugs, but have very stringent lifestyle interventions. And one thing I want to say before I end this question is that in lifestyle medicine, it's very important for us to realize that dosing is important. So if you want an outcome, the dose is important, it's dose dependent. So sometimes behavioral change is a problem, people don't get the outcomes, and that's because the dose is not commensurate with the results that you're expecting. So if you want a certain result, then you might need to transition from brisk walking to jogging to running, that kind of thing, because that is the dose. And then if you want to get certain results, you need to transition from reducing your portion size or actually working on your diet, which is why we preach whole food plant-based diet. We're saying that studies and more studies, just that there isn't time, to show that we have a lot of pro-inflammatory agents in some of our meals, like the fatty ones, meals that contain harmful fats like trans fats, oxidized fats, and all those saturated fats. We want people to eat more of polyunsaturated fat. I can't go into the details of that, but I had a webinar on Wednesday where I talked about this at length. It was organized by NMA, and they had CPD points and all that. And so you don't want to have those pro-inflammatory agents in your food, because they are the ones that trigger some of these chronic diseases. And so we want to avoid that, added sugars and all that as much as possible. So I think I'll stop answering my question here. Thank you.
Thank you so much. So from Dr. Dozier's submission, we can see that our patients do not need to continue to suffer the way they are suffering, either from, and a very intelligent doctor gave a talk this morning, I'm sorry, I can't remember your name now, from, I think, Ife, and he was talking about prediabetes as a very serious illness. We can see from Dr. Dozier's explanation of the DPP that actually lifestyle intervention, and we're going to talk a little bit more about the DPP with physical activity, with social connectedness as we go on. Lifestyle interventions have actually fare better than metformin in prediabetes. So on Wednesday, like Dr. Dozier alluded just now, she gave a 1-hour talk. We have every Wednesday, the Society of Lifestyle Medicine of Nigeria, we lecture people on lifestyle medicine, the pillars, and very, very, very interesting lectures. And she talked a lot about that. Now, this lecture is on our website, but unfortunately, it's open only to members. But every Wednesday, once a month, every Wednesday, we have this webinar for everyone. But every Wednesday of the week, of the month, we have lectures for our members. And all of us who are talking today have been internationally certified in lifestyle medicine. So that's a different examination and certification in it. So I appreciate your patience, and thank you so much, Dr. Dozier, for that. Before you go, Dr. Dozier, what will you say about labeling of food in Nigeria? And please just do this in a minute. Labeling of food in Nigeria, food contents of gari in the market, of one banana, of garden egg, and as we prescribe nutrition, as we prescribe food to our patients in our clinics, how do we actually, what are your comments about what's going on in our country, and what more can we do actually to improve food labeling, and so that people can appreciate the macronutrients, micronutrients, the carbohydrates, the fats, saturated fat, polyunsaturated fat, and so on? Please let us know. Give us an inkling on this.
Okay, so regarding food labeling, commonly we would find that most of our processed foods or packaged foods have labels, and companies, they use what they call the traffic light system of labeling. I'm sure you've noticed some of those packaged foods where you see red, you see yellow, you see green. So that tells you how much sugar is in something, how much calories, how much. So if it's red, then it's danger. Especially Kellogg's. I mean, they just lost a court case recently. I don't know if you came across that. So you see their sugar being red, even though it's a high fiber food, but the sugar part of it is red. So that's a danger sign, and people are confused. And yes, it's very confusing because this is rich in fiber and yet the sugar in it is red. So what do you do? It's usually better because, like I've talked about inflammatory, the sugar, the added sugars, the harmful fats are the key inflammatory things. So I would say, and I've talked about oil, and we even talked about the fact that our oil, the coconut oil, very, very rich in saturated fats, which is pro-inflammatory. You do not want that. Our palm oil, very rich in saturated fats. You want to minimize that. So how do we balance this out with our own local foods? I would say select restaurants that sell healthy foods. Minimize oily food. So your afang, your edikaiko, and all those ones, your egusi, those things that are really, really oily, you need to learn to cook without oil. Let me round up by saying, it's a long question, but I'll try, by saying that use your body parts. There's this common way we use our body parts to determine our portion sizes, because you can't talk about food groups, micro and micro, without talking about portion control, because no matter how healthy it is, you do not want to overeat anyway. So we usually say fist size for starch, thumb size for fat. That's equivalent to about a teaspoon, but I usually tell people, even if you take like a teaspoon and a half for thereabouts, 3 teaspoons, by the way, make 1 tablespoon. And then we talk about your palm size for the protein content you're going to get, then handful, that would be like this, for fruits and for vegetables. And then you can also have tennis ball size for fruits. And then if you're diabetic, your dietary requirement is different from somebody that is hypertensive. So hypertensive, we had the DASH1 study, the DASH sodium studies. Those are studies you want to look at for hypertension. And then there are many others for diabetes. So we have a lot of our native foods that are very rich. Talks about garlic, talks about garden eggs and all those things that you can use. Even our oil that is not so bad. Once you're within the that is not so fantastic because it has a lot of saturated fats and it's pro-inflammatory. But as long as you're restricting it to the portion size that is recommended, you're safe. I mean, you're relatively safe compared to eating it taking lots of oil in the food that you want to eat. So
thank you so much, Dr. Dozie. Thank you. I think we have so many more voices to come. So I'm sorry we can't stay all day talking about this, but I just want to wrap up that dietary nutrition session by saying that the plate method is a real game changer for our patients. And you've really used that to, telling us, using our body to estimate the portions. Somebody earlier this morning also referred to the plate method of having 50% of our plate full of vegetables and fruit, then the other 50% divided into carbohydrates and healthy proteins. So thank you so much. We continue to say the more health, the more whole, the more fresh, the more natural your food, the better. Avoid processed food. Very, very quickly. So that is our first pillar and how we can actually improve management of our patients using nutrition and their diet. Now, the next thing we want to talk about is sleep. I mean, it is now a known scientific fact that chronic sleep deprivation, that is sleeping less than 7 hours for most nights or all nights of the week, can actually increase your risk of developing type 2 diabetes. And on the contrary, sleeping routinely more than 9 hours for most nights can indeed triple your risk of type 2 diabetes. So sleep is very crucial. We don't often talk about it. We have compelling evidence to this effect. I'm going to invite Dr. Marvelous Njoko to give us an insight into this. Give us an insight into this because people need to understand that sleep is very important in the management of our patients. When our patients come to our clinics, do we actually ask, how is your sleep? How is your sleep? And let them talk. Open-ended question. How is your sleep? Not, do you sleep well? Because they'll say, oh yeah, I sleep well. Meanwhile, if you dig, it's probably 3, 4, 5 hours of sleep. How is your sleep? Let them tell us. Now, Dr. Njoko, have you used sleep as a modality of treatment in type 2 diabetes? Talk to us about this.
Okay, thank you very much, ma'am. Good morning, everyone. Sleep is one pillar in lifestyle medicine. And one thing about lifestyle medicine is that all the pillars are connected. So something like talk about diet, for instance, will have a role to play in sleep and vice versa. So when it comes to diabetes management, I'll reference a study on sleep restriction in about 4,000 Japanese men. And these people were over 20 years, and they all had type 2 diabetes. And what happened was they were grouped into 6 groups based on sleep duration. And studies were done and tests were done, and it was found that HbA1c was raised in those people who slept for less than 6 to 7 hours every night. And then also in people who slept for more than 9 hours. So that concluded that people who sleep for less than 6 to 7 hours every night are at increased risk of diabetes based on HbA1c levels, and also people who oversleep. All right, so you do not want to be on either side of the spectrum. So when my patients come to my practice, dietary health, one thing that we do in health coaching is to make sure that we find out how much sleep they have, because most people do not equate sleep with diabetes. Most people do not equate sleep with anything. They just feel like they're tired and that is where it ends. But it doesn't end there, because we know the relationship between sleep and obesity, right? Because studies have shown that people who have restricted sleep also have insulin resistance following obesity. Why does this happen? Because a lot of hormones are out of balance when you're sleep restricted. So you have the ghrelin leptin hormone, which is the satiety and hunger hormone, unbalanced. So this person will want to eat a lot of food during the day because they're sleep deprived. I think in this place, you know that any day that you did not sleep very well, you're tired, you're cranky, you're hungry. And you're not craving vegetables, of course. You're craving carbohydrate, you're craving Coke to keep you awake. You agree with me, right? So this has been scientifically proven. And when you're doing stuff like that, you're already at risk, because the more sugar you take in, and these hormones are already unbalanced. Once that happens, you're putting yourself at risk at both of abdominal obesity, which is the real problem, and insulin resistance and all of that. You also have the cortisol, the circadian rhythm that makes you sleep at night and keep you awake during the day is also disrupted. So like for people who have maybe night shifts or who are intentionally restricting their sleep because of motivational speakers or whatever, and you think that you want to be productive in the middle of the night, what happens is that you just disrupt your system, and all your hormones, your cortisol is over the charts, you have release of adrenaline and all of that, okay, just tips you towards insulin resistance, obesity, and then type 2 diabetes. So one thing I try to do is for every patient I have, there is a questionnaire that I make them fill. And one of the questions is to know how much sleep that they get. Also, how they feel when they wake up. So sleep quality is also important. Somebody might be sleeping all through the night and wake up in the morning feeling tired. That means you didn't get good quality sleep. Right. So we always try to address that through many lifestyle changes, including diet, exercise, and, sleep hygiene, teaching them what to do. For instance, the sleep requires sunlight, for example, tend to have problems sleeping later in the day. And they cannot correlate the two, but they are related, because sleep is formed in the morning, not in the evening. Sleep is formed from light exposure, right? So that's one of the things that we try to make our patients go through. And I've realized that every single time we did that, it worked. They start losing weight because many of them have been eating right and exercising. However, they've not seen improvement because they've not thought about sleep. So when we bring in the sleep factor and then they're sleeping well, the cortisol level has dropped down, melatonin level has stabilized, all those inflammatory processes, because restriction of sleep is also inflammatory. And she mentioned that about inflammation. So once those things are stabilized, you start seeing they're very happy, right? They're not happy people, they don't got cranky people. And this is play a role in blood sugar control. So they're happy, they're well connected with their families, they're eating better. Because when you are sleeping well, when you're well rested, they're going to eat better.
Thank you so much, Dr. Njoku. Can you hear me?
Yes, ma'am.
Okay. Technology is playing a fast one on me, but I'm glad you can hear me. I can't see anyone, but that's okay. I think that mentioning about sleep hygiene, I picked that on that. Can you just let us know very, very briefly, say in a minute, how we can advise our patients on sleep hygiene? understanding and remembering that the sleep hygiene actually starts the moment we wake up in the morning, and it starts with the number of coffees we take in the morning and so on. Just 1 minute, please, deal with that. And then we can move on to the next pillar, which is physical activity.
Okay, ma'am. So sleep hygiene, is a series of activities or behaviors that help you sleep better at night. And it starts from when you open your eyes. First of all, how much light? Because when your body needs light to wake up, basically. And when you wake up and you're still in darkness, maybe you're not working out or something, then the body doesn't know that you're awake per se. And it doesn't kick in. The melatonin doesn't kick in to be suppressed, and the cortisol increase and all of that. So you still have a long period where you are awake and the body is not doing what it's supposed to do. So when you wake up, please get some light. If you wake up too early and there's no sun outside, turn on all the lights in your house. Let your brain get the memo, it is morning. As soon as there is sun, step outside, get some sun, it will help. Secondly, don't take too much coffee. If you're a coffee drinker, you want to really reduce, especially after 3 p.m. in the afternoon, so that you don't get too much caffeine and it keeps you up at night. Then during the day, in the afternoon, try to be active. It helps when you're active, because the more active you are, the more sleepy you get in the night, right? So you want to do that, and it helps you, of course, to blood sugar control, all of that, but it helps your sleep too. Then when you're at night, towards evening, start tuning down, because the brain is a creature of habit. Your brain likes habit. Your brain doesn't like new things. So you want to teach your brain when to sleep. You want to teach your brain that it's time, so time, maybe 9 p.m., 10 p.m. is when I want to sleep. So by 7, you want to start turning down your lights, making your house a little bit darker than it would be during the day. So your brain starts to get the memo that, okay, it is night. Secondly, you want to reduce use of phones, screens, TV screens. The blue light affects the hormone, the melatonin, your sleep hormone. It suppresses it. So you want to stop using phones very close to the sleep time that you have set for yourself. So you want to in fact, take out your TVs from your room. If you have problems sleeping, you do not want to watch TV. Yes, ma'am, I saw that out. Yeah. So if you have problems sleeping, you don't want to have a TV facing your bed, because the light to suppress the sleep hormone, it passes through your eyes to your brain and you won't sleep. So these are some of the things. That if you find out that you're not sleeping when you want to sleep at night and you're in bed rolling up and down, stand up and go out of the bed. You want your brain to see bed for sleeping. You don't want to associate bed with watching movie, or bed with pressing phone, or bed with rolling up and down. Your brain will do whatever you teach it. So stand up, go back to the parlor, and then when you feel sleepy, come back and sleep.
Thank you so much, Dr. Njoko. I think we're going to move very swiftly, but I think that you've made the point that sleep is very important in the management of diabetes. And we as clinicians must remember to touch on this. And sometimes it helps to explain to patients how indeed sleep can affect their glucose control. And that may even help them to decide that, okay, I think I should be sleeping better. And WHO at this point will advise that we should sleep 7 to 8 hours every night, and not less and not more. So thank you so much on that. Dr. Makinde, I live in Abuja, and yesterday the FCT minister announced that they have decided to enforce the policy on parks in order to ensure the attainment of 40% threshold of green areas in the city. And many of us associate parks with physical activity, running, walking, and just relaxing, etc. I mean, we know, and because a lot of speakers before us in this summit have referenced physical activity and glucose control. There are very many well-designed studies that show that regular physical activity can prevent, treat, and in appropriate cases, even reverse type 2 diabetes. And reversing type 2 diabetes is sending it to remission, that all you need to manage it is eating properly, the whole food plant-based. This overwhelming evidence in literature changed your own practice, Dr. Makinde. What changed it? And I know that you have had some remarkable outcomes using this pillar of lifestyle medicine in your clinic. Can you briefly share any one with us, so that those of us who are here can learn and be encouraged that this really works?
Thank you very much, ma'am. Good morning, everyone. It's a pleasure to be here. Thank you to my two panelists. Just like Dr. Moye has said, it's been established that exercise, or what we will call purposeful, recurring, and regular physical activity, is effective in reversing, treating, and preventing type 2 diabetes. Now, I run a lifestyle medicine clinic in Lassus, and I've had the privilege of following up patients, coaching patients on lifestyle behavior, because we know that a lot of people are interested in what they eat when they have a lifestyle challenge, or they have a non-communicable illness. They ask me, doctor, is there something I'm eating or that I should stop eating? But aside from the dietary intervention that we've talked about, we hone in on, physical activity, and it's totally different from what people expect. Some people think they're physically active because they jump from one mole to another. They are always in traffic or moving around, but they don't know that that is stressful physical activity. They're actually eliciting the stress hormone, which will further create inflammation within the system, and that will not reduce their risk of developing type 2 diabetes. But what we are talking about is purposeful and intentional. It is planned, and it is structured. Now, before I talk about a patient that I managed, I just want to refer to a study. This study was actually a systemic review and a meta-analysis in which they were able to pull together a lot of studies that looked at physician advice on exercise or structured exercise training programs and their influence on the hemoglobin, that's the HbA1c, the glycated hemoglobin. And at the end of the day, the outcome was that we had further decreased glycated hemoglobin levels in patients or people who had structured aerobic exercise as compared with just physician-only advice. And this was irrespective of whether they were on a diet co-intervention or not. And I think this speaks very much to our practice, because if we just tell them, make sure you exercise, and we don't give them a guide, we don't give them a structure, they would think they're exercising, but they are not really adopting the WHO recommendation. And the minimum is a moderate intensity exercise, at least 150 minutes in a week. And we need to break it down. We'll let them know that it's 5 days in a week. They could either do 15 minutes, in the morning, 15 minutes in the evening, or they can have 10-minute bouts of exercise. However, it is convenient for them. Now, there was this patient I had. By the time he presented to me, 41-year-old, hypertensive. He was already having features of hypertensive heart disease. His HbA1c was 6.6%, and he was really worried. He was overweight, and he was interested in making a lifestyle change, and he didn't want to be on drugs. So there are some of our patients who will come and tell us, see, I'm tired of medication. I don't even want to be on medication. But we can't just take them off the medication without balancing it and without giving them enough information and ensuring they go through behavior change to adopt the dose-dependent behavior that will help them to improve their insulin levels as well as their glucose levels. So, well, this patient, one of the things that we did for him, that lifestyle intervention, was regular physical activity. And he started moderate intensity physical activity. That was brisk walking. That's the best that we can do, because many of us want to start skipping. We want to start jogging. We didn't do that in the first 30 years of our life. Your patient didn't do that, and you want to start that. You still end up with the orthopedic surgeon at the end of the day. So he started on 30 minutes daily, and then he increased it to 45. At a point, he even wanted to take it further, but I just told him, don't do more than 1 hour at a stretch, otherwise you end up with muscle injury. He was motivated, and that's one thing very key for our patients. And he was able to take this on, and we reversed the type 2 diabetes even without medication because of the motivation and because other lifestyle interventions were applied, including sleep, restorative sleep, as well as nutritional adjustments. Now, let me just quickly talk about one study before I round up, because it's quite interesting to me. We are not just talking about the purposeful physical activity alone, but even right here, I'm sure we've been sitting for up to 60 minutes right now. I've not been looking at the time, but I'm sure we've been sitting for at least 30 minutes or so. Now, there was this study that was done. It was a seminal study, actually, and 3 groups of people who were either obese or overweight. They were categorized into 3 groups. So we had the group that was the control group. We had the group who was told to sit down and move every 20 minutes for 2 minutes, light intensity exercise. The control group didn't move at all for the entire 120 minutes. Then the third group was told to move every 20 minutes for 2 minutes, moderate intensity exercise. And what was monitored were the glucose levels and the insulin levels. And this was after a glucose load. So what was assessed were their postprandial insulin as well as blood glucose levels. And at the end of the day, it was amazing that there was a reduction in the insulin levels as well as the postprandial blood sugar levels markedly compared to those people who were just sitting. But there was no significant difference between those who were on light intensity exercise every 20 minutes for 2 minutes and those who were on moderate intensity exercise every 20 minutes for 2 minutes. So that establishes the fact that you can begin your prevention right here, right in all the conferences that we go for, whether they are virtual, whether they are in person. You can move every 20 minutes. When you move every 20 minutes, then you speed up your metabolism and your body burns up all those calories, your insulin levels reduce, and you reduce the risk of type 2 diabetes. Let's start with us. And so
I think we should stand up at this point. Everybody, let's stretch a bit. Let's stretch out a bit. Yeah.
So I think I can round up on that.
Thank you so much, Dr. Makinde. Thank you. Thank you. That's really interesting.
The FIT principle. The FIT principle. So for our patients that we're prescribing physical activity for, there are 4 major things we need to look at. We need to look at the frequency. So don't just tell them, go and exercise every day, just make sure you exercise. You tell them how often they need to exercise. Then we look at I. I is intensity. What is the intensity of the exercise? Are they going to be on light intensity exercise or moderate intensity? Moderate intensity is what we need to achieve weight loss, as well as to also help in controlling or reducing our glucose levels. And then we also need to look at the type of the exercise. So we need to assess them and be sure that they have gone through what we call an exercise clearance and be sure that they can do what you are prescribing for them. And we need to look at the timing, for how long are they carrying out this physical activity. Thank you very much. I think we can sit down now.
Thank you. Yes, I think, thank you so much for reminding us to get up. That was a really good place to stop after the 3rd pillar, because we have the last 3 pillars to go through. And the next pillar, before we go even to the next pillar, it's all well and good also to say to people, walk. Please, let's remember to the condition of security, and let's make sure that it is safe to do so. Somebody else this morning also talked about riding bicycle, and make sure you're not being kidnapped on the road, and make sure the road is safe. I think this is a point we call on the governments of local government, state government, and the federal government to provide, look at the built environment and to provide parks, safe parks, where people can exercise, where people can relax and feel safe while they do so. So we know that smoking is one cause of type 2 diabetes. That I don't think there's any argument on that anymore. People who smoke cigarettes are 30 to 40% more likely to develop type 2 diabetes than people who don't smoke. And then what about people who have diabetes already and they smoke? They increase their risks for heart disease, kidney disease, poor blood flow to the limbs, and then they have amputations to the groin, and then they have erectile dysfunction. They have increased their risk to retinopathy, to peripheral neuropathy. The list is endless. Smoking alters the taste in the mouth. And so even all that Dr. Dozier has been preaching about nutrition is going to be tougher for the person who smokes and who is diabetic to follow a nutritious diet. It's going to be more difficult. So you say, but I don't have any training in smoking cessation as a physician. I agree. I didn't have a single minute of training in smoking cessation as a medical student or as a postgraduate student in family medicine. But hey, in lifestyle medicine, and I like to just address a question by somebody in the group chat. Let me get the name. Professor Chukwu Kwelu. Okay, thank you so much for raising some questions about, are we now dietitians? Are we now special, or whatever? Yes, we are trained. We are not dietitians. We are medical doctors. We are physiotherapists. We are, in fact, dietitians in lifestyle medicine. We are physiotherapists and so on, who have gone ahead to train in the specialty of lifestyle medicine with the curriculum, with clinical, with case reports, with an exam, and certified. So we are tutored, we are trained in what we are talking about. We don't take the place of dietitians, but we work with dietitians, and there are dietitians amongst us. Lifestyle medicine is a multidisciplinary specialty where there are so many disciplines that come together, but there is something that drives us. What drives us is to say, listen, guys, we can actually use lifestyle interventions as the primary modality of care. And if we do need to, we can bring conventional medicine as adjunct. Do you see what I mean? So that's the slight difference between us and the conventional clinicians or practitioners who first and probably only do conventional medicine. We say conventional medicine is good, but we believe a lot in lifestyle interventions, in all these pillars of diet and nutrition, of rest and sleep, of physical activity, avoiding toxic substances like tobacco, I've just alluded to, managing your stress, and maintaining positive social connections, that those are highly impactful to our health and well-being. And we want to push that. We actually prescribe these things. We prescribe nutrition, we prescribe sleep, we prescribe physical activity, and Dr. Makinde has so nicely told us about the fit and the way we prescribe it, and so on and so forth. So, and if you want some more information, one of my colleagues is going to put on the chat, I hope, the link how you can actually make some more inquiries and join us so that every week you learn so much more about this. Let me go back to smoking and diabetes with just the last statement. So, is it possible for a physician to advise the patient to stop smoking? Well, we have people who have trained in addiction medicine now, and so they are there to, there's so few in the world, let alone in Nigeria. There are very few in Nigeria. I know of one in Abuja. So while we don't have that human resource, we can all realize one thing, that studies have shown, several studies as a matter of fact, that brief advice intervention by physicians can actually give an additional 1 to 3% quit rate. Unassisted, a patient can actually, you have a 2 to 3% quit rate unassisted. And on top of that, if a physician spends another 2 minutes in the clinic to tell the patient what they stand to lose if they continue to smoke, and what they stand to gain when they stop smoking, that has actually been proven to create an additional 1 to 3% to the quit rate. So I think it's worth doing. And for those who are interested, there are lots of courses on addiction medicine that we in the site of lifestyle medicine can point you to online, and you can train in that. So without further ado, Dr. Data Spiff, are you still with us? Hello, Dr. Data Spiff. You're joining us online.
Hello,
but I can't see you.
Okay, I'm here, right here.
Wonderful.
Hello, Dr. Makinde.
That show you as Dr. Makinde, but you're not Dr. Makinde, you're Dr. Kaine Data Spiff. I want you to speak to the issue of stress management for managing diabetes and improving the management and getting better results and so on.
Hello, ma'am. Hello,
Can you hear? Yeah?
Your time is up, so I'm going to give you 5 minutes to please round up.
Okay. Okay, that's fine. I'm going to take 5 minutes and ask for an additional 5 minutes, please. Dr. Kaine, so you hear that? Tell us very quickly what we should do about stress and our patients with diabetes.
Okay, thank you very much, Ma. I'll just turn off my video because of the bandwidth. And good morning, everyone. And the conversations are have been ongoing, and very happy to be here. So stress management is often underplayed or downplayed in the management of diabetes as part of the pillars of lifestyle medicine, and then management of diabetes mellitus in particular, and other chronic medical conditions. But what exactly is the mechanism by which chronic stress causes or could lead to diabetes and other chronic medical conditions? I'll just elicit one or two. So we know that the hypothalamo-pituitary adrenal axis is responsible for the production of stress hormones like the adrenaline and noradrenaline and etc., I would say. Now, when an individual is exposed to conditions of chronic stress, it's also associated with an increase in cortisol production. Now, with the cortisol, the adrenaline and all that, the blood pressure is expected to increase in such conditions. There's endothelial dysfunction. There's also insulin resistance that would cause a sustained hyperglycemia. Now, also diabetic patients find it difficult to actually control their blood sugar when they are exposed to stressful conditions. So in managing our clients with lifestyle medicine, we propose some measures that would help to reduce stress to some appreciable level. So we cannot completely eliminate stress, like we all know, because we need stress in some measure to actually function physiologically. So we expect that our patients would be exposed to some level of stress management in terms of counseling, basically. Now, Dr. Makinde has talked about physical activity. It's been found that physical activity reduces stress, it increases the level of the happy hormones, and this has been found to dramatically reduce the hyperglycemic episodes in our clients with diabetes. Normally also for patients for people who are not diabetic or who do not have chronic medical conditions. Someone had talked about, Dr. Babasanya had talked about pre-diabetes. Yes, indeed. We ask our patients to practice some stress relaxing procedures like mindfulness-based meditation, yoga. I talked about physical activity that Dr. Makinde had also very well elucidated as contributing to a reduction in blood glucose generally. So these are stress relaxing mechanisms or techniques that can help invariably to reduce hyperglycemia in diabetic patients. Again, we had talked about nutrition. It's been found that whole food plant-based diet is also one of the mechanisms through which stress is also modulated. The more of the whole food plant-based diet meals that people consume, the less likely it is that they would be predisposed to stress and also eventually come down with the chronic medical conditions. Another very important mechanism of reducing stress, Dr. Marvin had also talked about sleep. So we see that the pillars of lifestyle medicine are actually all, I would regard them as a bouquet of interventions. It's not a one size fits all kind of thing, or having to use everything, to solve a particular problem. It's looking like that. And Dr. Moye had also mentioned this. These are cheaper alternatives to the use of drug. And I always like to tell my patients who are on the verge of developing diabetes, who are pre-diabetic, or who have some derangements in their blood sugar, to actually be very, very mindful of these stress modulating or stress relaxation techniques, because invariably they help to control the hyperglycemia that is a precursor, or the pre-diabetic condition that is a precursor to full-blown diabetes.
Thank you so much, Dr. We're going to wrap it up there before they snatch the microphone from us. Dr. Adelowo is with us, and I'm sure you guys will want to hear a man's voice. We're not just all women. Dr. Adelowo is speaking with to us from Abuja as well, and he's going to wrap it up with the absolute crucial necessity for us as physicians to help and ensure that our patients have positive social connections to improve their diabetic control. Dr. Adelowo, please lend your voice to this, and I know you're going to be talking to us very briefly also, and then we can round up. Thank you.
Thank you very much, ma. I hope everybody can hear me. I hope you can hear me, ma.
Yes, we can hear you.
Yes.
All right, thank you very much. So let me quickly use the next 5 minutes to talk about the role of social connectedness in the management and prevention of type 2 diabetes and many non-communicable diseases. Now, if you go back to the study that Dr. Odoze referred to, one of the key strategies they used was they connected all the patients to individual lifestyle coaches. And these people formed a bond with them. They formed, and they all went through a social connection together throughout that 2 years plus, and they were able to get the result. And so studies upon studies have shown that if people can have strong social connectedness with other people, it tends to improve a lot of indices in their body. How do we do this? Because of time, basically we know that the social hormones tend to get optimized. The endorphins, that is the feel-good hormones, the love hormones, oxytocin, and even serotonin, dopamine, they tend to be optimized, more optimally increased in the body when there's a good social connectedness. And when there's poor social connectedness, which we call social isolation or loneliness, they tend to be reduced. And when they are reduced, there is low motivation to do a lot of things, including eating well, engaging in physical activity. So even if you tell your patient, take X amount of, take this drug, when they are not socially connected, when there is poor social connection, there is low motivation to even take your drugs or to even do the lifestyle that we ask them to do. The other thing that we note is that when there is social isolation or loneliness, there is tendency to people to feel threatened, to be frightened. And when there is threatened, there is frightened, most times what happens is that the stress hormones goes up. Adrenaline, and cortisol. And we know very well from all of us have said that when there's a lot of cortisol in the system, it distorts the cardiometabolic health and it increases glucose in the system. It tends to insulin resistance tend to be worsened, and then diabetes comes into this space. Then other things tend to happen. There is pro-inflammatory cytokines are released when there is loneliness. There is free radicals are released in abundance in the system, and all these have their role to play in the eventual development of diabetes. Other things that tend to happen is that there is this social accountability that when there is enough social connectedness, you are accountable to your partner, to your friend, and you want to do the right thing with them. And the last thing I'd like to talk about is that nature doesn't accept vacuum. When there is social isolation, when there is loneliness, many times people body tends to fill it up by you craving for sugary things. People tend to now take a lot of alcohol, take tobacco, and these are the things that tend to happen. So many times people find it difficult to live a healthy life. Even your patients that is already taking their drugs, when they're expressing social isolation or loneliness, they find it difficult to continue taking those drugs. So these are some of the ways that poor social connectedness has a role to play in the prevention and control of type 2 diabetes mellitus. So I would like to conclude by saying that part of the management of our patients is to ensure that they have a strong social connectedness with each other, with their spouses, with their friends, with their neighbors. We are living in a world that, despite the fact that we have a lot of social connection gadgets, we are still not connected. Ensure that the device means to connect with their friends, with their neighbors, so that anytime they see them, there is this feel-good hormones that is released in their system, and it helps them to do the right thing. Thank you very much.
Thank you so much. So you can see that we need to ask our patients how they are. How are you really with your husband, with your wife, with your brothers, your sisters? So let us please remember, and employers, I need to remember this, please make sure that your staff are happy, and staff, please make sure you work well for your employers, because all of this can create all kinds of metabolic fracture inside of you. Physicians may not be able to change anything, but physicians and other healthcare providers can regularly raise awareness like we're doing today. And this can bring about action by legislators, and we can see legislative action as this time, as time goes on. So let's continue to raise awareness. Let's continue to talk about this in different fora. And again, I want to very particularly thank all members of the panel today, Dr. Dozier, who is the trasher of nutrition. She loves it. She's not a nutritionist, she's a medical doctor, a consultant, family physician, but she loves to talk about nutrition, and she's trained in it as well. Dr. Njoku, thank you. Dr. Moisore Makinde, who is again another in Lagos, a consultant family physician as well. Dr. Njoku is a GP in Lagos. Myself from Abuja. Dr. Data Speak is a consultant family physician in Lagos, and Dr. Bamidele Adelowo Abiodun is a public health consultant in Abuja. And we are all trained and certified in the new specialty of lifestyle medicine. I want to officially welcome every person who has attended this meeting to join us in our society. It's called the Society of Lifestyle Medicine of Nigeria. If you are a doctor, you are a nurse, a physiotherapist, a dietitian and nutritionist, oh, we love you guys. If you're a health coach, a health educator, if you go to our website, it's there, all the eligibility criteria for you to join as a professional. We meet every Wednesday and we teach. We teach, and you will know a lot more about what you've been hearing, a lot more. We just scratched the surface, and we are very grateful to the organizers of the Nigerian Diabetic Summit. We look forward eagerly to next year's meeting, and we are assuring you, I'm talking on behalf of the executive now, and we're assuring you that we shall partner and collaborate with you even at deeper levels. Thank you so much.
Thank you so much. We shall be
enjoy the rest of the day, and thank you for the extra 5 minutes. God bless you all.
Our bill. We shall be sending our bill for the 15-minute sponsored presentation that you gave on behalf of the Society of Lives. Thank you very much. A round of applause for all our panelists. We'd like to quickly take plaque presentations. Can I call? No, please sit down, ladies. We're going to, this services to always recognize those who come here. Professor Sonny Chinyele. Please step forward and quickly help us to previous panelists their presentations. Can I have
So on the officers and all of us who are physically present here, including those of them online. So Dr. Tunji Akindade, I'm presenting this to you, the immediate part chairman of MP. You are one of their member of our panel today. So thank you for coming. This is for the inaugural Nigerian Diabetes Summit. So we're really delighted to have you in our midst. Exactly, yes. And I believe that next year, you'll still be here with us. Thank you. Yes, Dr. Mablo Njoku, thank you for coming. Yes, we'll be hearing a lot of solo. I'm sure you know this lady in Port Harcourt, the other lady in family medicine now. Yeah, she's always talking about. So we're very much delighted to have you in our midst and for participating. We really gained so much. So on behalf of the organizers and all of us who are physical present, we present this to you. Yeah. Okay. Yeah. So Dr. Joma was here. So thank you for coming. I'm sure all of us, we are all delighted. We will all join a salon very soon. Excellent. We'll visit our website and know the details. So thank you for coming. On behalf of the organizer and all of us who are physical present, we'll give you this as a token to appreciate your coming. Thank you. Okay, thank you. Okay. So Dr. Makinde, again, we are very happy. We really enjoyed your excellent presentation. Like I said earlier on, we will all be interested to be part of a salon. Yes, I'm an endocrinologist. I'm sure there are a lot of things we can learn from you. So on behalf of the organizers, all of us who are physical present, to present this to you as a token to appreciate your contribution to this summit. Okay. Okay. Okay.
So Moya, you also have a plaque here. Dr. Adilowo, you also have a plaque here. And Dr. Dieter Spiff, you also have a plaque here. The organizers will find a way to get them across.